Safety first, safety always. This is the hallmark of treating pediatric dental patients. These are the people of Pediatric Dental Anesthesia Associates, the most experienced, the most qualified, board-certified medical pediatric anesthesiologists to help sleep children. I interviewed Tiffany Green, an outstanding pediatric dentist with 14 years of private practice experience, and we talked with Justin Horne, the Chief Executive Officer of Pediatric Dental Anesthesia Associates, about the company and about their procedures. Let's hear what they have to say. Hi, Tiffany.
Hi, Gerry.
Hello, Justin.
Hi, Dr. Samson.
Yeah. So, Tiffany, regarding Pediatric Dental Anesthesia Associates, how is that working out for you in your private practice?
They have been genuinely such a blessing. We were really struggling with getting kids into hospital treatment with fees and access. And they have come in and really fit a niche that it was a great need, and I couldn't have asked for a better partnership.
Now, and I have to admit, I'm curious, and I think you've already heard my feelings that if I was in private practice of restorative pediatric dentistry, there would be no second place. This is what I would be doing. How do the parents react to this? The entire service that they do, where they're paying, Justin, they pay PDAA directly, right?
Yes, sir.
So how do the parents react to that? How does all of that work with the financing? Is that working well for you?
Zero problems. Absolutely zero problems. We basically go through kind of our treatment plan, then we go through what PDAA has to offer and basically discuss their fee schedule, and then put them in contact with PDAA, and they handle the rest of it. And then they contact the patient again multiple times leading up to the appointment. But on the day of service, the nurses go out, they have nice conversations. Everything is streamlined. No one has any problem with that being separated, and they totally understand why there are two different fees.
But I guess that's because of the explanation from your team or from the PDAA people, or would you say it's both?
I would probably say it's both. I mean, I think they do a great job, but I think my office staff pride themselves on describing what happens, what you're going to get. In my office, I mean, you get that board-certified pediatric anesthesiologist plus 2 RNs that come in and provide a fabulous service. So these parents are very well aware of what their money is paying for and why we would only choose PDAA, because they put such a priority on the intake and the medical history and getting into the process, and then that recovery, which is, in my opinion, key in safety. And we stress that, PDAA stresses that. The parents totally understand what they are getting for their money, and they know they're getting the best service in town.
Well, my enthusiasm is more from the level of, for me, it's what if, and trying to be as careful as I possibly can with somebody's child at all times, and making everybody as comfortable as possible. Because you've heard me say this, Tiffany, I don't know if Justin's ever heard me say this, but being dual trained myself in both pediatric dentistry and orthodontics, I think orthodontists are pretending to be doctors. I mean, we don't sedate people. Orthodontists don't have to know about drug interactions. I mean, we don't have to know any of that stuff. Pediatric dentists really are doctors, and Pediatric Dental Anesthesia Associates are really substantially qualified. I like that whole image. Justin, anything to add?
Well, We value our relationship with Dr. Green and many other Annapolis members very, very well. We're very near and dear to our hearts. What she's describing about how our admin team interacts with her staff and the parents is exactly what we aim to bring to every office. We, when we're starting out with an office, I provide initial education to the team, office managers, treatment coordinators, in order to understand our process with our simple forms and, how to communicate what the parents are going to experience to them, financially as well as medically. And then the team, the dental staff is actually not, they're not collecting anything on our behalf or anything. It's just some education so the parents know that it's a separate entity and that, when they go home that we're going to be reaching out to them and, and taking care of everything so that the dental team really, our goal is for them to just stay focused on their dental treatment plans. And we need to take everything anesthesia related off their plate so they don't need to worry about it. And then, our admin team's reaching out to do all the, the financial and the administrative duties, and then the nurses will start to reach out and engage and do all the clearances and intakes like Dr. Green was describing. So when we get to the day of the sedation day, it's all about safety and service, and the parents don't have to worry about anything, that could have been taken care of, weeks in advance.
Wonderful. Anything additional you'd like to add, Tiffany?
I think that no one takes anesthesia lightly, or I don't think there are very many pediatric dentists out there that do. And if we can avoid it because we find other avenues of treatment available, then that's what we're going to choose. But in some circumstances, we need the benefits of anesthesia. And we, honestly, I'm grateful to have PDAA. And personally, I work with Dr. Watson. He is absolutely fabulous. The kids love him. I cannot tell you one parent that has not left my office and said, wow, this may be the easiest procedure that we've ever had. Thank you so much. Everyone has been great. Communication is perfect. Have felt very, very comfortable this entire time. So, and that's a credit to them. That's a credit to your office staffs. However that comes together, all parties involved have had no disappointments in my office.
Well, thanks for taking the time to speak with us, Tiffany. Justin, thanks.
Thank you, Dr. Samson. Thank you, Dr. Green.
You're welcome.